But of all of the mental health professions, psychologists get the most training in assessment, whether neuropsychological, whether psychodiagnostic, whether personality, whether sports or clinical or health. We get the most training in assessment. Have you ever wondered what clinical psychologists actually do besides talking to people on a couch? Well, a huge part of what we do are clinical psychological assessments, psychological evaluations, or psychological testing. These are tools and tests that help us understand someone's mind, emotions, behavior, and even their cognitive skills. And so whether it's to diagnose a mental health condition or whether to see what is actually going on under the hood to get a better idea of all of the symptoms that someone is presenting with. Today, I'll be breaking down some of the most common assessments that psychologists do in terms of their mental health treatment plan. My name is Dr. Phil Sarpon. I'm a clinical psychologist, and this channel is dedicated to all things psychology, wellness, and graduate school. We will go ahead and just jump right into the topic for today. So some of the more common things that are known about psychologists is that we do psychological assessments. Oftentimes, movies and shows will depict psychologists specifically doing personality assessments. These are those 3 to 5 minute quizzes that you can take on Google or online. Now, one of the things about assessments is that assessments is typically the biggest thing that differentiates psychologists from mental health therapists or even psychiatrists. Psychiatrists may focus more on medication, and they typically go to medical school and go through a medical residency in terms of psychiatry. And also for mental health therapists, they typically get a master's in licensed clinical social work or licensed professional counseling or licensed marriage and family therapy, whereas psychologists go specifically to clinical psychology programs, either PhDs or PsyDs, anywhere from 4 to 6 years. We go through a 1-year internship, additional postdoc fellowship, and then finally some board certification to become psychologist in a specific niche or specialty. And so some personality tests that are commonly associated with psychologists are the MMPI, the Big Five, or the NEO-PIR. These help us see patterns and behavior traits and sometimes predict how someone might actually react in stressful situations. Typically, the clinical interviews are not always formal. They are typically structured, so there may be a series of general questions or topics that we might want to discuss, but the interview is sort of semi-structured, and so there's give and take, there's opportunities to kind of go off script and ask other additional questions that we might need. And this often can take anywhere from 45 minutes to an hour and a half of just us collecting information and data. The MMPI is the commonly known personality assessment. This is the assessment that's been known to be used, especially for forensic assessments in cases, especially in some high celebrity cases. Typically, forensic psychologists are going to use this assessment whether or not to diagnose someone with narcissistic personality disorder, histrionic personality disorder, or some of the other personality disorders related to antisocial presentations. Another thing that's typically common for psychologists is that we typically do a lot of self-report questionnaires. This could be the PHQ-9 for depression, the GAD-7 for anxiety, or the PCL-5 for PTSD. Now, these again are self-reports, so we're giving these surveys or questionnaires, filling it out, and we take what they say based on what they report and measure it up against the general population. Oftentimes these self-reports are quick and they're just easy screeners to give us a better idea of what someone is presenting with, whether anxiety, depression, or PTSD. Typically, most clinicians aren't going to just use these things to diagnose someone with PTSD, anxiety, or depression. They will include some of these self-reports with a clinical interview and potentially with some other assessments to be able to get a firm diagnosis for clinical treatment and care. If you are into neuropsychology, there is a number of different types of neuropsychological assessments. There are IQ tests like the WAIS for adults. There's memory assessments and tests that are super important in cases for brain injuries and dementia. There is attention and executive functioning tests for ADHD, executive function challenges. There are also behavioral assessments that we do, which are all about observing what people do. These could be direct observations, functional behavior assessments, often used with children or people with developmental mental disorders to see and figure out why certain behaviors might be happening. You can oftentimes think of autism spectrum disorder utilizing some form of observational behavioral assessment to see what behaviors are happening for these specific individuals. The other thing is that we have specialized assessments. So for example, if someone is coming in with some suicidal ideation, we might do some specific risk assessments to measure and assess better for suicidality. Forensic psychologists may use their own assessments. Neuropsychiatric tests could be used with neurologists or psychiatrists or neuropsychologists. Basically, you can think of an assessment, whether it is a paper pencil test, whether it's something that you fill out on a computer, whether it's a question that is based on a Likert scale of 1 to 5, where you're rating the amount of symptoms or the amount of things that are going on for yourself. You can also think of it as a semi-structured interview where there are no questions that you can see in front of you, and the psychologist or the clinician is just asking you questions as if it's an interview. All of this is really key and unique for psychologists. Now, again, mental health therapists can do a little bit of assessment, and so can psychiatrists. But of all of the mental health professions, psychologists get the most training in assessment, whether neuropsychological, whether psychodiagnostic, whether personality, whether sports or clinical or health. We get the most training in assessment. We score them. We compare them to the national average. We will typically write a report on our findings. We'll give that feedback to the patient, and we'll always have specific recommendations for someone to get the specific type of help that they need. So for example, someone could come in, maybe they're dealing with some memory lapses, maybe they're dealing with a little bit of some post-concussion. We might give them an IQ test to see where they would measure up against other people in their age range. The other thing is that we might give some memory tests to see how badly their memory is right now after their car accident or after some type of incident that happened. The other thing that we might do is that after we do all of this assessment and all of the testing, we'll write a report. We might give recommendations to their neurologist. We might give recommendations to their therapist, or we might give them recommendations specifically to them to help them as it relates to their memory. Maybe if they're a student, we might give recommendations to their teacher or their professor as it relates to homework assignments and testing. Maybe they need to sit in front of the class. Maybe they need extra time to be able to finish exams. Maybe they need more visual aids from their teacher to help them as they're recovering from their post-concussion or some type of traumatic brain injury. And so you can see the value and the amazing opportunities that psychologists get to have specifically with their patients. Now, there are psychologists that only do testing. They don't do talk therapy at all. But there are a lot of psychologists who will do both. They'll do therapy as well as assessment on the side. If you're wanting to become a psychologist, please feel free to subscribe to this channel. I do my best to give you all of the tools needed to become a psychologist, to get into graduate school, to survive graduate school, and to start in your early career. So if you have not already, please subscribe to the channel. You can like and share this video, and hopefully I will see you all in the next video.